Would you like to breathe better, feel better, focus a little bit better, and of course, then be able to respond to adversity better? How about reducing stress? We can do all three with a three-part inspiration involving a little bit of mindfulness and focus. My name is Dr. Leonard P. Martineau. I've got a PhD in higher education. I'm a licensed massage and bodywork therapist, registered yoga teacher, and I've got a couple of certifications from the American Council on Exercise, one in personal training and one in health coaching. In this video, we're going to practice the three-part inspiration. We're going to focus on diaphragmatic breathing, which is basically belly breathing. We're going to focus on how to inflate the chest using our intercostal muscles. And then we're going to inflate the upper part of the chest with a focus on retraction of the shoulder blades. The only equipment you'll need is a chair. As with all of our techniques, modify everything we do as necessary depending on your own situation. Diaphragmatic breathing is also known as belly breathing. And we're going to use the diaphragm, which is our major muscle of inspiration. When we contract that diaphragm, it contracts downward, and the internal organs of our belly are distended outward, which is why they call it belly breathing, because your belly pops out. So let's just sit and practice that for a moment. Every time you inhale, just focus on releasing the lower parts of your ribs and allowing your belly to pop out as you inhale. When it's time to exhale, just passively let the air out. So we're really focusing on the inspiration for this phase. Again, inhale, really feel the belly open up, and then just passively exhale. So again, that's your diaphragm muscle. It is attached to your lower rib and lung area. So when it contracts downward, your belly will pop out. Just practice that for about 30 seconds. Belly breathing. Might even practice on slowing down the breath. It's always a good idea to close the eyes and maybe remove some external stimulation. And what you'll notice is a sense of relaxation as you belly breathe. The body is quiet. Normally you're sitting upright. If you can make the body vertical, it might help out a little bit more. But again, just slow, easy belly breaths. The second part of the three-part inspiration is inflation of the chest. So after the belly pops out, use your external intercostal muscles to really inflate the chest, make the chest nice and big. Let's just practice that. We'll practice the first two parts, which will be belly, then chest. So the next time you exhale, just make it a nice, slow, passive expiration. And then when you inhale, start with the belly, and then use those intercostal muscles to really inflate the chest. And again, on the expiration, just let it all go. Should be a relaxing, slow, easy breath. Belly, then chest. Try to do it a couple of times as if you were in a room and you wanted to practice your diaphragmatic breathing, but you could do it without anyone else noticing. So just a nice, easy belly. Inflate the chest. Exhale. Continue that for a moment or two while we describe the third part of the three-part breath. After you inflate and the belly pops out, and we inflate the chest using those external intercostal muscles. We're going to think about the back and the upper part of the lungs. Your shoulder blades, if you retract them, you really inflate the chest even more. But think about the shoulder blades like little triangles at the bottom, the inferior angles of your shoulder blades. If you can bring those towards each other, you'll probably notice that your chest opens up even a little bit more. We'll get some air into what we call the top of our lungs. So let's practice that now in 3 parts. We're going to go belly, then chest, then inflate the upper chest. Slow everything down, make it nice and easy. And on your next inspiration, belly, then chest, then retract the shoulder blades, inferior angles towards each other, inflate the top of the chest, big inspiration, and let it go. As you practice this 3-part inspiration and passive expiration, note that there are a couple of different techniques that you can use as far as the breathing is concerned. You can nose breathe, which is inhaling through the nose and exhaling through the nose. And then you can also use a technique where you inhale through the nose and exhale through the mouth. So whatever is more comfortable for you in this case, practice either nose breathing or inhaling through the nose, exhaling through the mouth, nice and slow. Belly and chest. Upper part of the chest, maybe even delay the breath slightly at the top. And release passively. Cycle through that a few times. And notice how you feel a little bit easier or a little bit more at ease when you just let go. Practice that on your own for about the next minute or two and try to really attempt to lengthen the spinal column and then relax and release into your 3-part inspiration. So I hope that you enjoyed practicing the 3-part inspiration, which consisted, of course, of belly breathing using the diaphragm muscles, inflating the chest using our external intercostals, and then inflating the upper chest using the trapezius muscle and the rhomboid muscle, those muscles that retract your shoulder blades. We also used a technique on expiration. There is a 3-part expiration technique, but we didn't go into that. That'll be in our next video. And we just used a nice passive expiration, and then we paid attention to all that, which facilitates focus and mindfulness. Hope you enjoyed this short experience and have a wonderful day.